Hi folks, I'm Dr. Tony Nesterenko, and I'd like to welcome you to our website today. And what I'd like to talk to you about is migraine and cluster headaches and how we treat it with brain-based therapy. Brain-based therapy was discovered by Dr. Frederick Carrick. He's a world-renowned neurologist, and he's the only neurological chiropractic fellow in the country. And what Dr. Carrick found was that these patients that have these migraine and cluster headaches have suffered from one of three things: emotional stress, chemical stress, or trauma. And that's what he wanted to know. You know, these patients were well one day, they didn't have migraines all their life. He wanted to know what happened, what went wrong with these patients to become from being well to getting sick. And what he found was one of those three things. So when you're under, let's talk about emotional stress first. Emotional stress, your body releases, your adrenal glands release cortisol in your bloodstream. Your adrenal glands sit on top of your kidneys, and cortisol in large doses is toxic to your brain. So we're talking about emotional stress, that maybe a very stressful job, maybe a sick family member you've taken care of, a divorce, anything that causes long-term stress. We're not talking about a day or two, we're talking about months or years of stress. Chemical stress can be smoking, drugs, alcohol, over-the-counter medications, prescription drugs, any of those things. And then trauma, of course, could be a car wreck, fall, anything of that nature. And what he found was that when these people had one of these three things happen to them, the upper brainstem, the mesencephalon, began to overfire, became overactive. And in turn, the cerebellum, which is the back part of the brain, which controls balance and coordination, it was not firing strong enough. And the frontal lobes, you have right and left frontal lobes, they were not getting strong enough firing from the cerebellums to fire to the lower brainstem to slow that upper brainstem down and keep it in check. Well, that's what he found the cause of these migraine and cluster headaches and many other chronic conditions, not just those two. So what you see with these migraine patients, 3 to 1 will have a what we call a classical migraine, where they get the visual aura, squiggly lines in the eyes, and you have the common migraine, which has no eye problems, but they do have the chronic pain and the debilitating headache with it. So I was trained by Dr. Michael Johnson, wrote this book right here, What Do You Do When the Medications Don't Work? A non-drug treatment for dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Dr. Johnson suffered with migraine headaches for years, and he's a chiropractor. He's very, very busy, had 3 clinics, and had a lot of stress, and was having these horrible migraines. He would get the visual aura, the halo, the squiggly lines in his eyes, and then about 20 to 30 minutes later he'd get the excruciating pain like a stabbing knife through his eye. And he tried many different chiropractors, tried all kinds of things, and he talks about it in his book. I think he went to 20 different chiropractors, and some helped him, but he never got well. He continued to have the migraines, tried different medications, and they began to not to work. And one day he hired a young associate doctor, and this associate doctor had been trained through the Carrick Institute, the Carrick method, and Dr. Johnson got under the Carrick method and has not had a migraine now since 1998, many years now. I myself have suffered with migraine headaches. I also had chronic insomnia, anxiety, bad anxiety when I lie down at night, and I'm not a nervous person, but it was an anxiety that you could not control. Also had chronic pain in both my arms, almost like fibromyalgia. So I've suffered with migraines, had about 1 to 2 a week. And the sleeping problems I was having, I'd maybe sleep 3 hours a night. I'd go to sleep, but I'd wake up and be up for 2 to 3 hours, and I'd maybe sleep for another hour, 45 minutes before I had to get up and go to work every day. I did that for about 2.5 years, and it literally about killed me. So I understand these migraines and this insomnia and chronic pain problem these patients have. So these cluster headache patients, now their headaches are totally different, but it still comes from the upper brainstem overfiring. They have intense, excruciating pain. that may last for a minute to 30 minutes. And they may have it 20 to 50 times a day. Also, they have stopped up, their nose usually gets stopped up on one side. The eye starts running with water, and it's very, very excruciating. I've seen a lot less cluster headache patients. It's not as common as migraine patients, but we have seen numerous cluster headache patients, and they respond great to brain-based therapy, just like the migraine patients do. We have seen patients from the Mayo Clinic. They've been to the Mayo, been to the Houston Headache Clinic, the Diamond Headache Clinic. We're talking about the top hospitals in the world, folks, and did not get results until going through our brain-based therapy program. So what we do with brain-based therapy, all right, let's talk about that a little bit. We use exercise with oxygen therapy. All right, so we want to get fuel, we want to get oxygen to that brain and that nervous system. We test our patients neurologically, and we want to test them neurologically so we can figure out which side of the body we adjust a patient on. We adjust them unilaterally, not on both sides of the body. So a patient comes in and says, "Doc, my right shoulder hurts," and we need to adjust them on their left side of the body. We don't worry about that. As long as we get that left cerebellum firing, that right brain firing, that right shoulder will get better. We'll never touch that right shoulder, or vice versa. It can be on the other side. You get that brain firing again, slow that upper brain stem down, and these patients with migraines and cluster headaches respond very well. Now, you stick with the program, follow through, do your oxygen, upper body ergometer, unilateral adjusting. We also use auricular therapy. It's like acupuncture on the ear, but we do it on the decreased cerebellum side. We also use auditory stem. There are discs that are made for right brain people and left brain people. So let's say we have decreased right cerebellum firing, we're going to have decreased left brain firing. So we listen to the sound, we listen to a disc that's made for a left brain person, we listen to it in our right ear, plug our left ear with a earplug, and we lie down and listen to that. And what that does, it gets that brain and cerebellum working so it can slow that upper brain stem down again, reconnects that circuit. A lot of these patients that suffer with migraine and cluster headaches have other symptoms they have is increased sweating, anxiety, insomnia. Our female patients a lot of times have chronic urinary tract infections. That's because the mesencephalon controls the bladder, and it will not let the bladder empty completely when it's overfiring. So some urine stays in the bladder, and you have chronic bacteria in there, and they get chronic infections, chronic urinary tract infections. What about the light sensitivity? You know, you see migraine patients, they come in with glasses on, or they want to go to a dark room and lie down and hide from the light. And what's wrong with that? On the decreased brain side, let's say it's the left brain that's not firing, the pupil on that side, when you get in light, the pupils are supposed to constrict. Cranial nerve 3 and 4 control that. But what you'll see on these patients, the pupil on the decreased brain side a lot of times will be larger when they're having a migraine. It will not let the pupil constrict, and it lets too much light in, so they want to wear glasses or they want to go into a dark room and hide. And that's the reason for that. So when you get that brain, that cerebellum firing, get that frontal lobe firing again, that pupil will go back to normal. Get that the cranial nerves working like they're supposed to work. Slow that upper brain stem down, that mesencephalon, and these patients get better. They completely change their life and get their life back. So if you're interested in getting your life back on track, and you're tired of lying in a dark room 1 to 2, 3, 4 days a week, some of my patients, they had headaches and lay in a bed for 3 to 4, 5, 6 days a week until one of these migraines go away. If you're tired of spending your life laying in bed in a dark room or suffering this intense pain that you get with the cluster headaches, and you're ready to make a change, we can help you do that, folks. We can help you get your life back on track. And brain-based therapy, it is a miracle, and it is the cause. It is the cause. The upper brainstem overfiring is the cause of these problems. Thank you, and I look forward to hearing from you. All right.